Imagine being an FDA medical reviewer, and your first assignment is to approve or deny a drug that is already being produced and prescribed to pregnant women in Europe. This drug is advertised to be as safe as aspirin. Would you, as an FDA medical reviewer, approve this drug automatically? Or before making a sound decision in which it affects the lives of millions of American people in regards to health and safety, what information would you request before making such a decision? This is the scenario that Dr. Frances Alton Kelsey was faced with as an FDA medical reviewer. Just as a roadmap, I will be discussing about her early life and career, her first assignment as an FDA reviewer, and how she became a pioneer of drug regulation. Originally from Canada, Dr. Kelsey earned her degree of a PhD in pharmacology and her medical degree at the University of Chicago during the 1950s. During this time, less than 10% of medical students and graduate students were women. Her very first assignment as an FDA medical reviewer was anything but easy. The first drug that she was assigned to approve or deny production in the United States was thalidomide. Thalidomide was already being prescribed to pregnant women in Europe to alleviate symptoms of pregnancy, such as nausea and difficulty sleeping. Dr. Kelsey reviewed the pharmaceutical's application only to find that there was some concerning issue about the lack of safety and toxicity data affiliated with thalidomide. Her work eventually became vindicated as different countries in Europe began reporting an increase of births where babies were born without limbs. And it was confirmed later that it was due to thalidomide, which became the thalidomide tragedy in Europe. After the lessons of the thalidomide crisis that hit Europe, Dr. Kelsey had every intention to ensure that such a tragedy did not hit the United States nor anywhere else in the world. So strict regulations were implemented in order to prevent this. And one of the things I would like to mention is that before she onboarded the FDA as a medical reviewer, obtaining consent from the patient when they participated in drug trials was not a requirement. And unfortunately, because of this, there were 17 cases of babies in the United States born without limbs due to thalidomide, and 9 other cases that could be possibly due to the same thing. And there was also an implementation that if there were any adverse effects, they must be reported to the FDA. Dr. Kelsey was awarded the President's Award for Distinguished Federal Civilian Service, which is the highest civilian honor that one can earn due to her work in assisting the United States in averting a crisis, as well as establishing strict drug regulations that pharmaceutical companies must follow in order to have approval to produce and market in the United States. Had it not been for Dr. Kelsey's persistence, maintaining the best interest for the American people, along with her knowledge in pharmacology and medicine, the thalidomide tragedy was able to be avoided in the United States at a large magnitude. Thanks to her, she established drug regulations that pharmaceutical companies must follow today should they want to manufacture and market their drug in the United States. Dr. Kelsey protected the American people like she would with any of her patients by doing things the right way with professionalism and morals. It is also worth mentioning that she was part of the 10% of females in the 1950s who pursued a medical degree and a doctorate, as well as hold a government position. I sometimes wonder how the FDA would have been if she was never appointed as a medical reviewer, or if she never completed her higher education. I can only hope for generations to come that we have more doctors like Dr. Kelsey to hold the FDA to the same standards, if not higher standards, when it comes to ensuring the health and safety of the American people as well as other populations around the world.